Your femur just snapped in half. The bone is sticking through your skin like a white flag of surrender, and the pain hits you like a freight train loaded with broken glass. You are 3 days from the nearest hospital, assuming hospitals still exist. Your medicine cabinet is empty. Your first aid kit is a joke, and the agony is so intense you cannot think straight. Here is what kills you. Not the break, but the shock. Pain shuts down your brain, stops you from making decisions, and those decisions are what keep you breathing. But you do not need a pharmacy. You need a tree. Willow bark contains salicin, the same compound your body converts into aspirin. Nature has been running this drug factory for millions of years, and today you are learning the protocol because one mistake turns your cure into poison. Willows are water addicts. They cluster around creeks, ponds, and wet ditches with drooping branches that sweep toward the ground, creating natural umbrellas. Their leaves are long, narrow, and pointed, like green daggers, usually 2 to 4 times longer than they are wide, and the edges have tiny serrations you can feel with your finger. But not all willows are safe, and confusing them is how people die. White willow, weeping willow, and black willow contain the highest salicin concentrations, and their bark is grayish-brown with deep vertical furrows. Scrape it, and the inner layer should taste bitter enough to make your face pucker. Crock willow and pussy willow work too, but they are weaker, meaning more bark and higher overdose risk. Poplar and aspen look similar, but their leaves are rounder and their chemistry is wrong. Birch is white and obvious, but desperation makes people reckless. The test that saves your life is the twig test. Willow bends without snapping, flexible, almost rubbery. If it cracks clean, you walk away. Timing matters. Spring through early summer gives peak potency. Strip bark from branches, not the trunk. Take vertical strips, never ring bark a tree, because that kills your future medicine. Scrape away the rough outer layer until you reach the smooth, greenish-white inner bark, because that is where the salicin lives. Taste every batch. Bitter means alive. Sweet or bland means wrong or dead. Take only what you need, because greed kills trees and removes your future options. Extraction requires precision. Chop bark into thumbnail-sized pieces for surface area. 1 cup bark to 10 cups water, no exceptions. Bring water to a rolling boil. Add bark, then reduce to a gentle simmer. Hard boiling destroys the compound. Simmer exactly 20 minutes until the liquid turns amber. Strain using cloth and press every drop. Save the bark for a weaker second extraction. Then reduce the liquid from 10 cups to 2 by gentle simmering, creating a bitter, concentrated extract. Clear amber, not cloudy. Intensely bitter, slightly astringent. Store it cool and dark because heat and light destroy salicin. Cold extraction works if fire is risky. Soak bark 24 hours for about 30% potency. Sometimes enough is enough. Improvise tools, rocks, shirts, cans, everything is equipment if you think correctly. Dosing is where people die. Start with 1 tablespoon. Wait 2 hours. If pain persists, take another. Never exceed 4 tablespoons in 24 hours. This treats inflammatory pain, swelling, headaches, and muscle injuries, but not nerve pain or internal trauma. For fever, take 1 tablespoon every 4 hours until temperature drops below 101 degrees. Never eliminate fever completely because fever fights infection. Contraindications are lethal. Aspirin allergy, stomach ulcers, blood thinners, children under 16, pregnancy, and nursing mothers are all hard no. Overdose shows up fast. Ringing ears, nausea, vomiting, confusion. Stop immediately. Hydrate aggressively. External poultices reduce risk. Mix extract with mud or clay. Apply to swollen areas. Timing matters. Take with food. Rest the injury. Never use longer than 7 days. Tolerance builds, toxicity follows. Monitor effects. Pain relief begins within 30 minutes, peaks at 2 hours. If nothing happens, your extraction failed or the pain type is wrong. Nature gives you the same medicine civilization does, but discipline keeps you alive. Identify by water, flexible twigs, and bitter inner bark. Extract with 10:1 ratios. Simmer 20 minutes, reduce to concentrate. Start with 1 tablespoon, wait 2 hours. Never exceed 4 daily. Respect contraindications or they kill you faster than the injury. Subscribe for advanced field medicine protocols that keep you functional when everything collapses. Next week, field surgery with household items.